In deep brain stimulation, there are a number of targets that we can select. The way that we choose those targets can be sometimes a little bit subjective. It can be based on our own experience and our own skills, but it can also be based on patient's specific symptoms and other factors. For example, the subthalamic nucleus. That's a great target to treat most of the symptoms of Parkinson's disease, including the tremor, the slowness, the stiffness, and it helps them to reduce their medications in most cases. One of the problems with the subthalamic nucleus is that it can sometimes cause some cognitive problems or problems with patients' thinking after the surgery. It can also affect depression. So we screen patients to make sure that they're not at high risk of developing those types of problems. And if they are, we would choose another target. The thalamus. The thalamus is a fantastic target for tremor. And in patients that predominantly have a tremor problem, then that would be the target of choice. In some patients, we might choose the globus pallidus internus. And the globus pallidus internus, or GPI, can be used to treat most of the symptoms of Parkinson's disease, and it may not carry the same risks of problems with thinking, problems with depression, as stimulation of the subthalamic nucleus does. And so deciding which target to choose, it's often not straightforward. We often need to go through a process of assessing the patient very thoroughly with clinical psychology and neuropsychology, and that's why we do those things. And then we look at what symptoms they've got, what things that bother them the most are about their condition, and we put all of that together and we say, okay, this is the target that we're going to select. If we pick a target and we don't have any luck during the surgery in trying to reduce their symptoms, then we can always pick another target, and we have that capacity, and that's what we occasionally have to do. Fortunately, in most cases, the target that we choose does deliver a reasonable benefit, and we don't have to go down that path of looking at other targets. Another target in the brain that can be used particularly for tremor is the posterior subthalamic area. And what I often do is I will target both the thalamus and the posterior subthalamic area in certain patients. And we've found that you can deliver a reasonable benefit to these patients in terms of their tremor. Some patients with Parkinson's disease have particular problems with their gait or their walking. And when they have a lot of gait freezing, that aspect of their condition may not always respond to the more traditional targets. And we've used the Pedunculopontine Nucleus, or PPN, to treat that aspect of their condition. And in some patients that can work. There's not a huge body of evidence yet around the world to show whether that target is going to deliver good long-term benefits, but certainly some patients will derive benefit in that situation. Our ability to target areas in the brain has increased dramatically over the past few years with better quality MRI scanning. We can see these structures that we had to imagine where they might have been. We used to have to take measurements from certain more obvious structures in the brain and really hazard an educated guess as to where we should put the electrode. With better imaging, we can now see some of these areas, and we can pick not only the target, but we can pick exactly whereabouts in that target we want the electrode to sit. When you combine that with better surgical techniques, better quality electrodes, all of those things, we believe that that can deliver a better outcome for the patient.